While many people are still battling the coronavirus and its long-term effects, the pandemic has also brought on a lot of anxiety among both adults and children. Well, experts working with kids say they've received more and more requests lately to treat children with anxiety. And to discuss how COVID-19 affects children's mental health, let's speak to Dr. Alicia Porter from the South African Society for Psychiatry. Thank you so much for joining us, Dr. Porter. Dr. Porter, I don't know many people at the moment, especially with teens, who aren't looking to book them in for some kind of therapy. They've really taken a knock.
Hi, morning. Yes, the children, adolescents, teenagers, they really are struggling at the moment. And while they've been spared, or they haven't been necessarily the face of the pandemic with regards to the direct health impact of the COVID-19 pandemic, they definitely, the pandemic has definitely had a profound effect on their mental well-being. And I mean, just in our clinics, we're seeing increase in anxiety, we're seeing increase in depression, stress, suicidal thoughts. We're seeing, even in some early signs of post-traumatic stress, we're seeing a spike in the admissions for eating disorders, which prior to the pandemic was a problem. But I think the pandemic has definitely intensified the challenges that we face with the mental health of children and adolescents. So it's been rough.
Dr. Porter, some of the issues that kids are facing is, for me, half of school is about academia and the other half is about learning how to socialize and how to be and find your way in the world. Are children just feeling very isolated and lonely, which is triggering anxiety?
I mean, that is triggering anxiety because with children and adolescents, we always look through a developmental lens. So what should be happening developmentally? What is developmentally appropriate? And I mean, so the isolation has been difficult, or it has impacted on them. Just now going to school online medium, because with the school closures, because school is not, like you say, it's not just about the academics, there's the social aspect to that. So there's definitely an increase in the amount of anxiety created by the fact that we can't socialize. And even when we do socialize, we're not socializing as normal. We're socializing at a distance. We've got to wear masks. I mean, I was talking to somebody who works at a junior school recently, and they said the instances of reported bullying has increased because with the mask, there's a lot of communication that is missed. And so children are really, and just not having extramural activities, sporting events being cancelled, or even just events like a matric ball. Those were the highlights of the high school career, and now there's so much uncertainty. So that definitely increases, anxiety in children. It just increases stress, and it really is a challenge at this point in time.
Finally, what can we as parents do to try and support our children and to make them feel assured and comforted and held in some way?
I mean, I think the challenge for parents is that we first need to calm our own, or address our own anxieties, because children feed off adults. So they feed off our conversations, they feed off how we feel. So it's so important as adults to actually put our masks on first and begin to understand and manage our own anxieties, because like we know with COVID, it affects not just some of us, it has affected all of us. So that's the first thing that parents need to do. The second thing that parents would then need to do is limit children's exposure to things like social media and the different platforms out there, and limit the exposure to the information out there. They would need to filter what children listen to. Again, it's becoming more and more difficult also with online schooling, where they have more access to the internet. So that just puts them at increased risk for finding, stuff or inappropriate content on the internet. So it's about, limiting, filtering. It's also about acknowledging that it's not okay. It's acknowledging their feelings, also giving them space and creating safe spaces where we can talk about how we're feeling about what's happening, and also in some way to maintain connection. Sometimes it's not just physical, physical connection is what's limited, but just assist them in maintaining connection with their peer groups via WhatsApp or even just virtual calls. We need to begin to get creative about play dates and all of those things. And also just to give them a sense of that they can also be helpful in some way, that they can help. And also just mind, the language that we speak, the conversations that we have at home, this doom and gloom, that impacts children because they don't have to necessarily have experienced it. They can be traumatized just by hearing about something.
Dr. Porter, thank you so much. I think this is an issue that so many parents are desperately trying to find answers to, and they need help as much as kids do. Dr. Alicia Porter from the South African Society for Psychiatry.